Come in.
Hi, my name is Delaney. I'm going to be your nurse today. Can you verify your name and date of birth for me?
Yes, it's Alyssa Anderson, 7/31/1990.
Perfect. So I'm just going to put on my gloves and then I'm going to perform a physical assessment on your head, neck, eyes, and ears. So first I'm just going to start by observing your facial features, and your eyes, eyebrows, your skull, your skin, cheeks, and ears all look very symmetrical. And now I'm just going to start by checking your trigeminal nerve, which is your cranial nerve 5. So I'm going to palpate your muscle. Can you clench your teeth together? Good. And now can you tell me if you feel this cotton? Good. So the patient was able to feel the cotton on the forehead, cheek, and chin. Now I'm going to assess your cranial nerve 7, which is your facial nerve. So can you raise your eyebrows and close your eyes really tight? Good. So your facial nerve is intact. And now I'm going to palpate your head and look for any lesions, redness, or excessive dryness in your scalp. And I do not see any. And now I'm going to palpate your sinuses. So this is your frontal sinus. Do you feel any pain?
No.
Good. I do not feel any tenderness. And your maxillary, do you feel any pain?
No.
Good. I do not feel any tenderness. Now I'm going to palpate for TMJ. So can you open your jaw? Good. And close. Good. So I do not feel any tenderness or grinding, and I do not hear any clicking. So now I'm going to palpate your temporal artery. Do you feel any pain?
No.
Good. I do not feel any tenderness. Now I'm going to auscultate your temporal artery. Good. I do not hear any bruise on your temporal artery. And now I'm going to assess your neck and your neck veins, and I do not see any bulging of your neck veins, and everything looks very symmetrical. And now I'm going to have you tilt your head back and swallow. Good. Your trachea moves up and down, and it is in the midline. And now can you tilt your head forward and to the side? Good. And swallow. Good. So I was not able to palpate your thyroid, which is good. And now I'm going to palpate your lymph nodes. So these are your pre-auricular, your post-auricular, occipital, posterior cervical, your deep cervical, superficial cervical, tonsillar, submandibular, submental, and supraclavicular. So now I'm going to test your spinal accessory, which is your cranial nerve 11. So I'm going to put my hands on your shoulders, and can you raise them against the resistance? Good. And now I'm going to put my hand on your cheek. Can you turn it towards the resistance? Good. And on the other side. Perfect. So now I'm going to move to your eyes, and everything looks symmetrical and good around your eyes, and all your facial features, including your eyebrows, and your eyelids look good with no redness, and your eyelashes look good, and your pupil and iris look round and regular. And now I'm going to palpate around the orbital area. So do you feel any pain?
No.
Good. And I'm going to palpate your lacrimal duct. Do you feel any pain?
No.
Good. And now I'm going to test your conjunctiva. So can you look up for me? Good. The conjunctiva is pink and looks normal. So everything looks normal. Now I'm going to assess your cranial nerve 2, which is your optic nerve. So now I'm going to have you hold this card and hold it in front of one of your eyes, and hold this card 14 inches away from your face and read the smallest line you can.
428739.
Good. And then the other eye.
428739.
Perfect. So both eyes are reading at 20/20 vision, and I'm going to test your peripheral vision with the confrontation test. So can you cover your left eye for me and I'll cover my right. And tell me when you see my fingers.
No. No. No.
Good. And now the other eye.
No. No. No.
Good. So the patient was able to see my fingers peripherally at the same time that I was. And now I'm going to test your cranial nerve 3, which is your ocular motor, and your cranial nerve 4, which is your trochlear, and your cranial nerve 6, which is your abducens. So now I'm going to use the 6 cardinal fields test, and can you follow with just your eyes my finger? Good, so the patient was able to follow my finger with no nystagmus present, and now I'm going to test for lid lag, so can you look up and down for me? Good, so I do not see any lid lag or lagging of your eyes. And now I'm going to do the cover test, so can you cover one of your eyes and look to the side and down and uncover? Good, so both eyes moved at the same time in the same direction, and can you do the other side? And look to the side and down and uncover. Good, so again, both of the eyes moved at the same time in the same direction. There was no lagging there. And so now I'm going to turn off the lights and perform the corneal light reflex test. So I'm going to look, and the light reflects in both corneas at the same spot. And now I'm going to perform the pupil response to direct light. So I'm going to shine the light in one eye. Good. And now the other eye. Perfect. So in both eyes, both pupils responded to direct and consensual light, and they both constricted. The one with the light shown in it constricted, as well as the other one with the light not shown in it. And now I'm going to perform the accommodation test. So can you look past me? And then I'm going to tell you when to look at the pen light. Go ahead. Good, so both eyes turn inward and the pupils constricted. And now I'm going to move to your ears. So I'm going to palpate the pinna and look for any lesions, edema, or dryness, and I do not see any. Do you feel any pain?
No.
Good, so now I'm going to use the otoscope, and I'm going to use with my right hand on her right ear, and I'm going to, since she is an adult, I'm going to pull the pinna up and back with my left hand. And I'm going to look, and the tympanic membrane is a pearly gray color, and it is intact, and there is light reflection present, and the cone of light is at 5 o'clock in her right ear. Now I'm going to look in her left ear. I'm going to use my left hand, and with my right hand I'm going to pull the ear up and back. And I do see that the tympanic membrane is a pearly gray color. It is intact, and there is light reflection present. The cone of light I saw was at 7 o'clock in her left ear. And now I am going to test the cranial nerve 8, which is the acoustic nerve. So I'm going to have you occlude one of your ears, and I'm going to whisper 3 words on the other ear, on the other side, and I'm going to have you repeat them back to me when you hear them.
Dog. Dog, cat, bunny.
Good. And now can you include the other ear, and I'm going to do the same thing on this side.
Frog, jump, walk.
Good. So the patient was able to hear in both ears and repeat all the 3 words back to me. So now I'm going to do the Rhine test, and I'm going to initiate the tuning fork and put it on your mastoid, process and test for bone conduction, and then when you no longer hear it, I'm going to move it to the side of your ear and test for air conduction.
No. No.
Good. Now I'm just going to repeat that on the other side to test your other ear.
No. No.
Good. And now the last test I'm going to perform is the Weber test. So I'm going to place this on the top of your head, and can you tell me if you can hear the vibration in both ears?
Yes.
Good. The patient was able to hear the vibration in both ears. Okay, Alyssa, that is all that I have for you today. Do you have any questions?
No.
Okay, perfect. Thank you for your time.